So hello everybody, good evening and welcome to the Nursing Open House. I'd like to introduce myself. My name is Shelley Fraser and I'm the Associate Dean for the School of Nursing, and I'm so excited to have you all here tonight. How many people, but just by show of hands, have visited BCIT before? Okay, so a fair number of you. I'm fairly new into this position, so joined the BCIT team about a month ago, and I found the campus and the faculty and the student body to be really inspiring. It's a very exciting place to be. So welcome to you all. I also want to just acknowledge the organizers of the event, so the people that are working late on AV and Aaron and others that have helped to bring us all together tonight, because it's really great to have you all here and to meet the potential students that are interested in our program. It was only, well, it was more than a few years that I sat in your seat and was contemplating a career in nursing and applying to different schools and going through the somewhat tedious process of getting my applications together. But I have to say, since that time, 25 years now, there hasn't been a day that I've regretted my choice in the profession of nursing. And so it's a really exciting time to be. I also want to acknowledge that many of you may have heard or not that 2020 has been named by the World Health Organization as the year of the nurse and the midwife. And what this is acknowledgement of the critical role nurses will play in global health going forward. So it's a very exciting time to contemplate that career choice. So I know you're here for information, so I'm not going to take up a lot of time, but to introduce our MC for the evening. Her name is Sharda, and just a little bit about her before she comes up and takes over from me. She's one of BCIT's faculty, and her clinical background is in pediatrics and mental health. And a bit of a fun fact is that she's an avid soccer player, and she told me what position she plays, which I wrote down. Yes, full-back defender, so she's fierce. So please join me in welcoming Haroop, or Roop as we know, to the podium, who will go through the agenda. And I hope you enjoy the evening, get all the information that you need to make an informed choice of your future education. Good luck with that process. Thank you.
Thank you, Shelley, for that wonderful introduction. I'm not so fierce. I try to be, kind and welcoming, so don't hesitate to ask questions. As Shelley introduced, my name is Haroop Sharda, and I am the Faculty Development Coordinator in the nursing program here at BCIT. So my role is to work with our amazing faculty in helping them continue their education and help them achieve excellence so that they can help our students achieve excellence as well. Part of what I'm going to talk about for this part of the session is just a few quick facts about our program. We've recently redesigned our program because we work very closely with industry. We work very closely with our healthcare partners to be really in the know of what's needed, not just today in nursing and in healthcare, but in the next 5, 10, 20 years. So we've redesigned a curriculum that is going to help us graduate nurses that are meeting the needs of the future in healthcare. So our program, as it is in this redesigned model, is a 3-year program, as it was before. It's year-round, so we have in total in those 3 years 9 terms. So we have a fall term, which runs from September to December. We have a winter term, which runs from January to about April. And then starting mid-April to the end of July, or just sort of the first week of August, and it varies based on the year, is our spring term. So that's an important thing to know. The content of our program is that it's a mix. So as you know, nursing is an applied profession, and we teach students in an applied way. So a lot of time is spent in practicing what knowledge and skills in nursing. But that practice happens in different places. So we have laboratory simulation, classroom, and hospital-based clinical settings. When our students start out in their first year, they have more of their experiential learning happening in the classroom, in the lab and in simulation. And that's done deliberately because we want to ensure that a very safe and high-quality learner is going out into settings where the stakes are higher and where you are in front of patients. And that's something that we have planned in partnership with our healthcare partners to ensure that the most prepared student is going out there to look after patients to be as safe as possible. In the second and third years, of course, it increases the amount of time that you're actually spending in those clinical-based settings, and those vary. So our traditional ideas of nursing is that nursing always happens in a hospital, and while that's true, nursing happens in many other places as well. And so for that reason, our experiences vary from home care to public health to hospital settings. And the public health piece of our program is very, very strong because, again, as I stated earlier, we are looking to graduate nurses who are prepared for the future and where healthcare is going. Okay. We have a really, really strong focus in our program on leadership. We put a really, really strong emphasis on preparing our students to be leaders in healthcare. One of the values that we hold really strong to is excellence in nursing practice. So with our redesign, we've aimed to be a really high-quality program that ensures that our graduates are heading out there to be leaders in the profession. So you'll find that that's a graduate attribute that we hold really, really significant. The NCLEX, you may already know or not know, this is the licensing exam that students take in order to be licensed to practice. So before you're registered and able to go out there and be job ready, this is the exam you have to pass. Ours here at BCIT the rate is very high, so about 90% pass rate on this exam, which speaks to how we prepare our students, not just for the exam, because the exam actually measures your ability to go out there and be safe as a practicing registered nurse. And so we prepare you for that, and in doing so, we prepare you to be successful on the NCLEX. So I'm going to talk a little bit about what a BCIT nursing graduate will look like. So after you have completed the program and gone out there into the workforce, these are the attributes up here that you see on the screen that you will espouse that our graduates espouse as nurses. We, again, place a really heavy emphasis on professionalism, and that is a very significant part of registered nursing. Is, again, because leadership is an attribute that we encourage, professionalism is very important, and nursing is a profession. And for that reason, it's an attribute that we've incorporated in our framework. I've spoken to leadership. Advocacy is another attribute that all nurses espouse as those who are working with people who might be in vulnerable populations, people who require nurses as professionals to provide advocacy in order for people to be able to gain access to the healthcare that they need. And nurses play an important role in that. We do a lot within the program, we do a lot of team-based work in your learning. So it's really important that we emulate what's happening out there in the real world. In healthcare, nurses don't work alone. They work with other nurses. They work with people that are part of an interdisciplinary healthcare team, physicians, social workers, dietitians, licensed practical nurses. There's a variety of other health professionals that you have to be used to working with. And so for that reason, we encourage you to learn how to do that within our program. So being collaborative and learning how to work cooperatively with other people is something we help you learn in our program. Global citizenship is something that nursing has really emphasized as a significant part of a focus, where we have a real changing landscape, and it's something Shelley just spoke to when she spoke. Canada is dynamic, and the health issues and trends that we experience are ever changing. And also beyond the landscape of Canada, there's global nursing as an opportunity where the doors are wide open, and much is needed in that regard. And one of the people that is on our panel will speak to the significance of global citizenship as an attribute for nursing. But that's something that we also prepare you for. We have courses embedded within our curriculum that focus heavily on global citizenship. So that's part of what we also do. Lifelong learning is an attribute that all nurses have, and as I can speak to that as faculty development within our program, even our educators who have had many, many years of education and training and experience continue to learn and continue to seek out learning experiences, and part of my role is helping them do that. We prepare nurses who will go on and want to continue to pursue more education, more training, and continue on as lifelong learners to pursue that excellence. That's part of our value set. Communication is a really, really important part of nursing. I'll speak to that in the next slide. But one of the attributes of our students is as they graduate, they come out and they are excellent, confident communicators. And we have several courses embedded within our program that help to enhance your communication skills and progress them to more and more sophisticated levels as you move through our program. So that's another attribute that's really, really important for us. So what makes a successful student here at BCIT, or a successful BSN student? Well, a big one is an effective communicator. So although it's a big part of our curriculum, it's great to come in with that skill. So if you see yourself as a really strong communicator, that's a really, really valuable asset to have coming in. And if you don't, then maybe it's something to assess and think about working on. Having related volunteer or work experience is really helpful. And what that is varies. We have a lot of people do assume that having healthcare related volunteer experiences is what we're looking at. But one of the things in nursing, and once you're in our program, that are very, very valuable is to have teamwork related skills. So if you've ever coached, or if you've ever volunteered with a sports team, if you've played sports on a team, this is actually, the skills that you gain from that can be very valuable and contribute to your success in the program as well. I spoke to leadership skills, although we really support our students in developing their leadership skills while they're here, and it's one of our graduate attributes that we aim to help you achieve. Coming in with some of those skills and really looking at what you've done to work on that aspect of yourself is something that is also valued highly. It can be really stressful to be in our program. And I think that not unmanageable stress, natural stress that comes with coursework, with learning a brand new discipline, and the added pressures of being in a clinical environment. Maybe you've never even been in a hospital before, and that can feel scary. But having the ability to cope with stress well and effectively is a really important aspect coming in. So being able to know how to do that for yourself, and having already good knowledge of how you're fit to organize yourself and have a strong sense of what you need to do when you are experiencing more stress, that's really, really valuable. So thinking about that and having a plan in mind will really help with success. We encourage you to have good math skills. And yes, in nursing, we do a lot of calculations for medications and that. So that's sort of your linear math skills. But beyond that, conceptual learning of math, which I know is something that's being taught in the K-12 system and in other aspects of education right now, helps you learn how to apply problem solving. So we do focus on having strong math skills, and that it also is telling of if you're able to sort of work through complex problems, which can translate into working through problems in other contexts as well. Okay, so this brings us to the part of today's session where we have a panel. I think this will be interesting. There's four nurses here, me included, who are going to speak to their careers as nurses. And where they've gone, where they've taken their careers. And three of the four people on this panel are actually BCIT graduates, ranging in the amount of time that they've been nurses. And you'll find that with the four people, including myself, our experiences are really vast, and we've done very, very different things, despite having the same education. We start with having everybody come up one at a time, or okay. So I'll start with myself. So I graduated a long time ago. It's been 20 years for me, and I didn't graduate from BCIT. I graduated from another program, and when I did, I started my experience as a pediatric nurse at Children's Hospital. And I was really fortunate because I had an interest in two different specialties, and I was actually able to also work in adult mental health because I had a passion for both. And the profession is so broad that I was able to do that. Eventually, both sets of experiences brought me to a place where I was able to do work with the Ministry of Children and Family Development, where I worked with child protection, looking at the mental health of children, and I worked in some areas where in adult mental health it led me to administration, and I was able to take on some leadership positions as well. So my career has been vast. I haven't gone overseas or done anything outside of the local area, but I have been able to take my passion for working with people who have mental health issues and with children, and really forge ahead with both those specialties and find some great opportunities based on having had those experiences. I've done a lot of additional education and training that I've found very, very rewarding, and it's never felt overwhelming or onerous or burdensome to learn more. It's always been something I look forward to and want to do. Being in this profession is something that I've never regretted. I've sort of see it as a calling, in that many of the values of nursing make their way into my personal life as well. I find myself always assessing and evaluating and doing things that nurses are always doing, and I would never say that it's ever been a detriment. So the doors it's opened have been invaluable. I've gone on to get my master's degree as well, and of course in nursing, but I was able to do it with a focus on education, and that's how I ended up here. So it's not only let me hone in on my passion for children and for mental health, but also for education. So if there was ever a time when I was little and I wanted to be a teacher, it's fulfilling that passion as well, which is true. I thought about being a teacher when I was a kid. So now I also get to do that. Again, I think the kind of take-home message is that nursing for me has been not a job or a trade. It's a profession, it's a discipline, it's sort of a way of life, and it's something that I've invested a lot of myself in, and it's been rewarding all along. Not without its challenges, always very challenging, both emotionally and physically, but always rewarding. So I think that's sort of where I would say my nursing experience has taken me so far. Still got a road ahead. But I think at that, I'm going to let our other great panel members share their experiences. So you're going to meet now Kayla Deboda, who graduated from our program here in 2017. And Kayla was a former student of mine and an excellent one at that. I had the good fortune of teaching Kayla in mental health, but she's going to speak to her experiences after she graduated our program with you now.
Hi guys, so I'm Kayla. I am a BCIT alumni of 2017. I graduated December of 2017. So I'll talk a little bit about my experience and my career in the past 2 years. So I graduated December 2017, and shortly afterwards I went to the high acuity cardiac unit at Royal Columbian Hospital. I was accepted into the position there, and I was quickly put through the high acuity program so that I could care for the acute and critically ill patients on the admit cardiac unit there. So around September of 2018, so about 6 months or so after I finished graduating BCIT, I came back, and it was great. I did the high acuity specialty at BCIT, and the program was about 8 weeks long, 6 to 8 weeks long. And I was lucky that I got placed actually at the Royal Columbian High Acuity Unit. So it was the same hospital as where I was at, just a different unit. So the unit that I was on was fantastic, and I fell in love with it. So I actually ended up making the switch over to the high acuity unit. So as soon as I finished the program, I started a full-time position in the high acuity unit. The manager recruited me into the unit. And I've been there since. So I've been there since about November 2018 is when I started officially. So I made this switch over to the high acuity unit just because I really enjoyed the diversity of the patients that we saw there. We saw patients as young as 15 or 16 years old all the way up to 100 years old. We saw patients that were multi-trauma. We saw mental health patients. We saw cardiac patients, neuro patients. So I really do enjoy the diversity of the patients that we have there, as well as the acuity of the patients there. And currently I'm at the high acuity unit right now, and being a BCIT graduate, I've absolutely got drilled in with leadership, and I did a lot of work in leadership during my time at BCIT, and I got very, very passionate about being a leader and about being an advocate in healthcare. And so right now I am actually in the process of applying to the nurse practitioner program, so I'm hoping that's where the next few years will kind of take me at UBC, doing the nurse practitioner program, and I'm hoping to work in the community. I'm hoping to work with families and maybe even in mental health. I was very, very passionate. I did some work around mental health during my time at BCIT. So that's kind of my experience. Yeah, I don't know if you guys have any questions, but yeah. Okay.
That's great.
Okay,
Thank you so much.
Thank you so much, Kayla, for sharing your experience. You've done so much. And it's amazing to see that you've come back and now you're moving forward as well. And that's another stream that a direction that nurses can take is the nurse practitioner program as well. So it's lovely to see that you're moving there. Thank you. So we have 2 more people to share their experiences with you. Next we have Kelly Third, also a graduate of our program in 2012. Welcome, Kelly.
Is it okay if I use this mic? Yeah. Okay. Hello. So to talk about my career, I have to start a little bit before I became a nurse because I was a mature student when I came to BCIT. I worked in construction management before I decided to make the switch to nursing. Some think that's a bit odd. I felt very natural with that. So I went from construction to healthcare, and I think it's important to say that this program really married my previous experiences, gave me the training I needed, and then I was able to carry those experiences I had before in my career into my new career, and I was quite grateful for that. And it certainly offered me opportunities that I think would not have been available to me as quickly had I not had that experience as well before becoming a nurse. So pretty soon after graduation, not unlike Kayla's story, I was quickly snatched up with a job, and I actually got a job at the hospital St. Paul's where I did my preceptorship, so I really enjoyed working there, and it just seemed like a natural flow. I began my career working in palliative care and at the HIV unit at St. Paul's. I was quite passionate about working with marginalized populations or vulnerable populations, and I also really liked the opportunity of, I think, working with our international population here in Vancouver. But I was always quite passionate about doing work abroad as well. Before I became a nurse, I had done some volunteer work in East Africa, so I knew that was going to be somewhere I was going to want to take those skills. So I worked as a nurse for a couple years and knew that I wanted to be a lifelong learner and continue to strap on new challenges. So I did my master's degree in public health, global health. So that program is at Simon Fraser University, and it's not a nursing master's degree, it's an interdisciplinary master's degree, and I chose that because I'm sure you've heard a little bit in the talk that we are sort of moving more towards team-based care, where we're working really closely with the other disciplines that help provide the excellent care that we do to our clients. And I wanted to also learn with these people in my master's degree, so I was quite pleased with my experience there at SFU, and I found that it offered me the opportunity to do some of my schooling abroad. So I did my field studies in Nairobi, Kenya, and I stayed there for a while teaching and learning. While I was learning, I also did some volunteer work as a nurse educator. And so I worked with marginalized populations and the delivery of palliative care in really low resource settings. So I went out into really rural communities where you drive for 7 or 8 hours into rural settings and provide palliative care. So that's care of people who are nearing the end of their life and making sure we're keeping them safe and dignified and pain-free in that process. I learned a lot in that, and it certainly has shaped me as an individual, and I brought a lot of those skills back to my job at St. Paul's. I continued to work at St. Paul's, and I took on a role as the clinical nurse leader for the palliative care unit. So I would manage the day-to-day care of all the patients on the unit. And then when I finished my master's, I was recruited by the professional practice department, and I worked as a general nurse educator. So I rolled out practice initiatives, big changes, organizational change, helping keep us all on our good, safe practice. And as part of that, I also oriented all of the new hires. So all of the nurses that were hired to Providence Healthcare would get to spend a whole week with me, and we would teach them everything that they needed to know in order to set them up for success when they worked with us at Providence Healthcare. I very much enjoyed my time being a nurse educator, and think sometimes I wonder if I'll return to that role, but currently I'm working as a manager. So I graduated 8 years ago, and I'm a patient care manager for the inpatient surgery department at St. Paul's. So I can't speak highly enough about my time at BCIT and what a dramatic boost that gave me in my career. And I continue to volunteer with BCIT and with other nursing students. I was here last night as part of the peak leadership thing, and I'm here today, and I do continue to mentor nursing students. Even though I have a busy schedule, I always make time for that because I find it very rewarding, and I think that that's a big part of my stewardship as a nurse, to continue to make sure that we're setting people up for success and making sure that our population is well cared for with quality, professional, wonderful learners and nurses. And I've presented at conferences and really been able to engage with the community at large, and realizing that our community sometimes is really small, and then when you reach out and realize, Vancouver, and then Canada, and then North America, the global community gets really large really quick, and we have amazing similarities in those areas, and yet tremendous lessons to learn from each other. I actually live in another country. I commute from the United States, and that's because my husband's American. Anyways, I gladly drive from one country to another every day because I love what I do, and I wouldn't want to do it anywhere else. So thank you so much for listening to me, and yeah, nice to meet you.
That is amazing, Kelly. That is inspiring. Truly, to have had an 8-year career that it's been so full, and that you have done so much, and really sort of, again, a testament to pretty amazing program, but pretty amazing people we have here, and also really hit the check marks on many of those graduate attributes that we talked about, what these nurses look like when they graduate: global citizens, great communicators, leaders, lifelong learners, right? We've got 2 people here who have gone on to seek out more and more education, so it's quite lovely. Thank you for sharing your experience, Kelly. We have one more person to share their nursing experience with us. This is Robert Paquin, who graduated our program in 2014, and Robert was a student of mine in a communication course, and an excellent student at that, and here he is back to share with us what he's been doing since he graduated. Welcome, Rob.
That was such a nice intro. That $10 I paid you is definitely reaping its rewards. Not in nursing school, outside of nursing school. Funny enough, that picture's me in undergrad. BCIT. When I was asked to come by and meet all you lovely folks, I thought to myself, what have I done since I graduated from BCIT? And when you start to take stock, it's kind of interesting because you can start to attribute it to some really important watershed moments in your life. And I think one of the watershed moments in my life was actually attending BCIT. The school was fantastic. I was uncomfortable every single day, and I think that's a really good thing. I'm not talking discomfort in the way that's negative, I'm talking growth discomfort. In a way that makes you a better person, lets you achieve something more than you thought you could. And I really, if I'm being honest, that's nursing. I couldn't be happier that I chose nursing as a career. I did have a previous career in healthcare before I became a nurse. I was a paramedic for a while, and I would go to the hospitals and I would think to myself, oh my God, these people know so much. Why are they so calm? This guy's dying. And so I thought, well, I should probably do that. I think that seems like a really good idea. So I started looking into it, started looking through a bunch of schools, and I realized that BCIT was head and shoulders the best school to be going to. I found that the nurses were extremely good critical thinkers, they were extremely forward thinking, and they were the leaders in the department. So I did my degree at BCIT, and I was very fortunate, again, very similar story. Mums and dads who were in the room, yes, I got lots of job offers. It's a nice thing to have multiple places to potentially work. And I was offered a job at one of the level 1 trauma facilities in the emergency department in Lower Mainland. So I worked at a Royal Columbian for a while with folks who are having the worst day of their entire life. And for me, I love that. And if you're rolling your eyes right now and you're thinking like, oh, that sounds really bad, that's okay, no big deal. But for me, that's really what gets me up in the morning. That ability to connect with a human when they are really, really in complete crisis is very fulfilling. Once again, the seeds from that, definitely born at BCIT. For myself, so I worked out of that trauma facility for quite a while, and then decided I needed to change things up and wanted to take another opportunity that was available to me, and something I had been doing and very passionate about for a long time, which was teaching. And through taking my emergency specialty here at BCIT and taking my undergraduate here, I had the opportunity to start teaching military paramedics, started teaching NATO members of the NATO forces coming over to Canada, doing advanced life support training, physicians even coming over to do kind of stuff like that. Once again, seeds of that, all born out of BCIT. Also had the opportunity to start working with advanced life support paramedics in Lower Mainland of BC. So those are the folks who are going to really, really sick calls, flying in helicopters, that kind of stuff. Once again, seeds of being able to be in those conversations and make an impact in that education, born at BCIT. So since then, teaching has become my full-time career. I work at BCIT now. I'm full-time faculty member in the specialty nursing division. So I'm in the emergency specialty. So after individuals graduate from BCIT or other schools, they come to BCIT, and we provide them with specialty education to work in some critical care areas, specialty areas, that type of thing. And once again, I love working with BCIT graduates because I know what they know. I know what they've been through. I know that they are very resilient. I know that they are leaders. I know they are excellent communicators. I know that they have an ability to connect with a patient and really make an impact in someone's life. The other pieces that I found of what I've done since graduation are kind of interesting, and I didn't realize how much BCIT affected them until I was sitting at my desk today actually legitimately thinking about this. And so for myself, like Kelly, I also speak at a lot of conferences. I've had the good fortune of being asked to come out to Philadelphia and to St. John's, New Brunswick, and into Australia to do some talks. And because of my underpinnings of BCIT, I've had the ability to connect with humans and to create some content out there that hopefully is helping other folks develop a passion for working with folks on the worst day of their life. I think ultimately, a BSN, an undergraduate degree in nursing, is a phenomenal vehicle for a career. You can do anything with a nursing degree. You can hear from the 3-4 people that are up here. If we pulled some folks in the back of the room, I guarantee their stories are also quite diverse in how they got here. I have friends that I graduated with who are now in their PhD programs doing informatics work, folks who have done their MBA and they're now working for consulting firms, building hospitals. Anything you can think of, you can do with a nursing degree, especially if you care about patients and you care about health outcomes. I can't be happier with my choice in degree, and I hope that you'll definitely consider BCIT as well. I think it's a phenomenal place to go to school, and hopefully see you on campus. Cheers.
Thank you so much, Rob. That was excellent. Again, I am in awe. I spend so much of my time here. I don't realize what our graduates are doing out there, the phenomenal stuff that is happening that was, as Rob said, born here at BCIT. So thank you so much for sharing your experiences. That's incredibly valuable. And hopefully it's been informative for you. And I would echo Rob's comments about having a nursing degree opening multiple doors. It really has become an opportunity to really do anything, as he said. So keep that in mind as you're deciding what it is you're gonna do. So I think that does take us to the next part of this session. We have Willa Bao, who's going to come up and speak to you about program advising, and maybe be able to maybe answer some questions you might have. And thank you again to our speakers so much. Thank you. And welcome, Willa.
Hi everyone, my name is Willa and I'm a program advisor at BCIT. So program advising, we aim to help prospective students such as yourselves. So the next intake that you're able to apply to is for January 2021, and all the deadlines and the application open dates are available online. So this slide talks about the academic requirements to apply to nursing. For English, it is extremely important that you have an excellent working knowledge of the English language. You'll be communicating with your classmates, your instructors, other healthcare professionals, talking about very complicated medical terminology. You'll also have to be able to summarize and synthesize all these complicated medical terminologies and processes to the patients that you will be caring for in order for them to be able to understand, what's going on with their care. We get a lot of questions about the academic foundations requirements. So these are 18 credits of post-secondary, meaning university or college level courses. For the academic writing, the anatomy physiology, and the psychology courses, Most people will complete their schooling elsewhere, which is really great. So that's why we have an equivalency table on the program entry page that will list the various courses from other local institutions that BCIT will accept for those 3 requirements. For the general education electives, these are like elective courses. We do have a PDF document also on the program entry page that provides a description of what kind of courses you can use towards these general education elective requirements. We don't have a specific list of courses just because there are hundreds and thousands of courses that could potentially fill the requirements of a general education elective. So use that PDF document as your guideline while applying. This slide talks about the non-academic requirements. So for the CASPER, that's an online personality assessment, and that's done through the third party, CASPER. So if you have any questions about how long your test results are valid for, which test dates are for which intakes, you can direct those questions to CASPER. We also have a mandatory applicant questionnaire, and that's the place where you can talk about your work experience and your volunteer experience. So paid work experience can count towards your application, meaning that it will give you points towards your application. So some related experience can be things like being an LPN, being a paramedic, or being a care aide. Some other somewhat related professions can be things like a medical office assistant, a lifeguard, or even things like coaching or missionary work or veterinarian experience. Those can also be part of this paid work experience. But also don't be afraid to mention customer service experience. That too can be part of your application. As for volunteer experience, it's not necessary, meaning that it won't contribute to points towards your application, but it can serve as a tiebreaker, meaning that if 2 applicants, they both have excellent grades, they have great work experience, but, one person might have some volunteer experience that another person doesn't, that can make a difference, of who gets offered a seat and who doesn't. So it's still, worth mentioning in that mandatory applicant questionnaire. So the application process is pretty straightforward. I just want to highlight number 3 on that list. So all of your transcripts and documentation must be submitted by the application deadline. So there's no separate deadline for transcripts. Everything has to be ready by the deadline. And those transcripts must be scanned as a PDF and uploaded with your online application. So do not mail anything to BCIT as part of your application. Also, don't include anything that's unnecessary. So you don't have to include reference letters with your online application. You'll be talking about your work experience and your volunteer experience in that mandatory applicant questionnaire. So we do provide a lot of student services for students to help them succeed academically, professionally, and also enhance their overall well-being. For you guys as prospective students, you can access some resources as well. So firstly, program advising, that's where I work. We can help you figure out, how to apply to the nursing program, and also how to make your application more competitive. You can also access financial aid and awards. They have information on how to fund your full-time education. So here are some links just to learn more about BCIT. For the nursing program, I really recommend the YouTube channel. It has a few videos about the day in the life of a nursing student, which are really informative. Also, we have a open house coming up. It's called Big Info. on the 19th of February. So if you don't have a chance to connect with the nursing department tonight, you can also come by on the 19th and connect with them there as well. Yep, and this is just the contact information for program advising. So again, we can answer all of your questions regarding how to apply to the nursing program and how to make your application more competitive.